Here is your question. All right. So if you have read and understood, considering it history taking station, kindly please begin.
Okay. Hello, I'm Dr. Faizan. I'm one of the surgical doctors. May I confirm your name, Anish, please?
Yes, Tom, 55 years old.
Nice to meet you, Mr. John. Today I've been asked to examine. Today I've been asked to. Today I'll be asking you some questions related to your condition. Is that okay with you?
Yes. Or maybe you can ask a open question. What makes you come today to us, or how can we help you?
Okay. How can I help you today?
Yes, I'm actually really worried because I'm passing a blood in my loo, and this is like from last few weeks. I'm really worried. I don't know what to do.
Oh, I'm sorry to hear that. We will try our best to figure out your problem and give you a solution. Can you tell me more about it? How did it start?
I don't know. It just started all of a sudden 5 weeks ago when I noticed that it's blood is being passed in my loo, and I was not feeling any pain, and it was just happening, and it's not getting better. It's just becoming worse and worse. And even I've
Okay.
started
Is it
feeling pain from last 2 days.
okay? I'm sorry to hear that. Does this blood? Do you have any clots coming in your urine? Blood clots?
Yes, yes.
Okay. Is has it been present throughout, or was it episodic?
What
This
I've
issue?
noticed, it's throughout, but more in the
Okay.
beginning, yes.
Okay. Uh, and do you have any weight loss, loss
Ye-
of appetite?
Yes, my clothes have become little hangy, and I'm feeling really tired and really worn out.
Okay. Do you have any burning in your urine when you pass urine?
No, nothing like that.
Okay. Do you have any difficulty in starting your urine stream when you go to the loo?
No, not that I noticed. No.
Is there any dribbling of urine after you pass urine?
No, not always. Yes, once or twice I've noticed.
Okay. Uh, do you have any bleeding from anywhere else in your body?
No, not at all.
Okay. Are you on any blood thinners or
No,
are you
no.
on any?
I'm just hypertensive,
Okay.
and I'm just taking medications, and my GP says that it's controlled. Nothing else I'm taking.
Okay. What medication are you taking for hypertension, if I may know?
Yes, I'm taking 25 milligram metoprolol
Okay.
twice a day. Yes.
Uh, okay, noted. Did you experience any trauma to your abdomen or private parts?
No, not at all. You'll just say your private area, not abdomen. Yes, continue, please.
Okay. Okay. Do you have any other medical conditions apart from your hypertension? Any other medical problems?
No, I'm just
Okay. Do you
no.
have okay. Do you have any allergies?
No, not that I know of.
Did you undergo any surgeries in the past?
No, not at all.
Okay. And does anybody in your family have a similar complaint?
No, not in my knowledge.
Okay. And is there what is your occupation, Mr. Jones?
Yeah, I work in a factory. Mostly we work with the dyes.
Okay, noted. Uh, do you stay alone at home, or whom do you
No,
stay with
I'm
at your home?
married, and two adult children who have flown out of the house.
Okay. Uh, do you smoke, Mr. Jones?
Yes, yes, I smoke. Since yeah, since my teenagehood. It's going well.
Oh, okay. How many cigarettes do you smoke in a day?
Oh, don't have a count like this, but as much as I need the kick, so I smoke. Maybe two
Okay.
packs.
Do
Yes.
you drink alcohol?
Just
Okay.
occasionally.
Okay. What do you think is what is your idea about your condition?
I don't know. I'm just getting weak and weak every day, so it's like kind of making me worried.
Okay. Do you feel do you feel sometimes that your heart is beating fast or anything like that?
Yes, yes. All right. Can you summarize your history taking now?
Yes. A 56-year-old male patient was a factory worker came to the hospital with complaints of blood in urine for the past 5 weeks, which was gradual in onset and has been worsening. And the patient has been feeling weak and fatigued recently, and there is no associated pain. There is no problems in the urinary stream. There's no family history of similar complaints. There is no bleeding from any other site in the body. The
All
patient
right.
is not on any blood thinners.
Yes. So what are
On
your provisional and differential diagnosis for this patient?
Yes, my provisional diagnosis is a malignancy. Could be a bladder cancer or a renal cancer or yeah, bladder cancer or a renal cell cancer,
Yes.
and
Differential.
it could also be a renal stone or a ureteric stone, but here the patient doesn't have pain, and it could be a urinary tract infection, uh, pyelonephritis or cystitis or urethritis. It could
How
be,
do you suggest the patient should be managed?
yes, I will investigate the patient. I will get full blood count. I will get a CRP. I will get a complete urine examination, including urine um culture sensitivity, and also I will urine cytology. And I will do clotting screen, and also prostate specific antigen.
Very good.
The
What treatment can you suggest to the patient?
treatment will depend on the diagnosis. If the patient is having a malignancy, then I will do a staging of the tumor, and
Yes.
based on the stage, if it is an early stage of bladder cancer, then the transurethral dissection of the bladder tumor followed by installation of chemotherapy
Yes.
can be done. And in late stages, it will be mainly chemotherapy and radiotherapy.
Palliatives. Yes. Very good. Okay. Good. Thank you. If time would have allowed you, how would you have completed your history taking?
Yes, I would have done the systemic history as well,
Yes.
and the ideas, concerns, and expectations of the patient.
Yes. All right. One more. Yes. When you started off very well. It's just the feedback that I'm trying to give you. You'll listen to the recording and you'll realize what are the things that you missed. Okay, you have asked about the condition, how the onset, the timing, the severity, very nice. When it comes to associated symptoms, patient told you from two days, it has become like painful. Then you could have asked about the score from 1 to 10, how much painful patient is experiencing, and is it every time patient passes urine, patient feels the pain, or is it the pain in the tummy, or does it radiates anywhere, the pain? The frequency, if patient has felt any change in the frequency, if it has become or it has given patient the inconvenience of incontinence, if patient is like having a irresistible urge to pass urine or whatever, if patient is having any nocturia, if you did ask about the stream, yes, or and dribbling, so this you covered. Constitutional symptoms, like you did ask about the weight loss, but the appetite, if it has affected the appetite of the patient. Yes, these
Okay.
are the small things that should have been asked. Very good.
Pain, I forgot to elaborate.
Yeah, just little bit. And the appetite. Good.
Yes.
Thank you.